Hello, my name is Richard Swift. I'm Company Secretary of the Therapy Database, a British registered charity. I'd like to show you the easy navigation for the Therapy Database. Most people, most of the time, are quite happy using search boxes and Google, but because the database is designed for people who are likely to be traumatized following a fairly unpleasant diagnosis of a disease, we've made a very easy navigation system that lets people get down, see to the information they want, and also be able to see how they got there. So let's have a look at the computer screen and see here's the front page of the Therapy Database. And what I'm going to do, if we can just zoom in on that, please, I'll take you to see it. Now, because all treatments are only relevant to conditions, we start with conditions. Some treatments are good for some conditions and, of course, no good for others. So that's why we start with conditions. So when we go on here, we have 4 example conditions here. And let's choose cancers. Just out of interest, our reference patient that we always refer to is Mary. Mary's a 52-year-old lady who's come away from the doctors rather confused and distressed with a diagnosis of breast cancer. So what we'll do here, we'll go to cancers, and then we'll go to breast cancers. Let this load up. And we have now 2 choices. We have Western mainstream treatments or other treatments. Now, quite often the terms orthodox or conventional and alternative or complementary are used. But we're using the terms Western mainstream because that's what orthodox medicine is. And it's not really right or fair to take Ayurvedic or traditional Chinese medicine with 5,000 years of history and just lump it in with alternatives, okay? So we're using the phrase other treatments or other schools of medicine. Let's take other treatments for the moment. And here we have 5 example other treatments. Let's take, for example, antineoplastins, which were developed by Dr. Brzezinski. And here we have 1, 2, 3, 4, 5 typical articles in favor and 5 typical articles against. And if you look at the top here now, we've got a little breadcrumb moving along here. Conditions, cancers, breast cancer, other treatments, antineoplastin. So one sees how one's got there and can always go back again. So again, if we take an article in favor, you see it has readability C, which means it's fairly technical, reliability B, which means it isn't some formalized clinical trial, but it has been quite responsibly written. Going down here, we go down to the bottom of this, and we see at the bottom the web source from which this article came. Okay, then we can go back to the top, back to antineoplastins again, and we can find an article against, which is readability B, and reliability is given an A in this case. And again, this is where it comes from. So we can do this with any, the same system applies to all treatments. So one can go to breast cancer, and then you can look at other Western mainstream treatments, and again, you find exactly the same layout all the way through. So I hope that look at the computer screen was useful. There's a lot more to the Therapy Database, but that you can see is very clearly laid out so that even a traumatized person who's rather confused and upset will be able to see where they are, how they got there, and where they want to go next. And this is one of the major requirements of any good information system, that it puts people in power. It gives them a map as to the landscape of treatments available to them. so that they may not like where they are or want to be there, but at least they're not lost in that land. And that's an enormously empowering and useful thing. That's the primary purpose of the therapy database. In the next video, we'll be looking at why these different the approach of articles in favour and articles against is so useful. Thank you. I hope that's been helpful.